Hi, good morning. How are you?
Good, thank you.
So you had some surgery with Dr. Wiggins a short while ago. Tell us a little bit about what you had done.
I had a breast augmentation. I had them enhanced.
And why did you choose Dr. Wiggins?
Well, I'd asked around for recommendations for Botox and probably asked 5 people. 3 out of the 5 said Dr. Wiggins. His name kept coming up. So I'd been coming to him for about a year, and then I decided to have the breast augmentation, and I knew he was the right person to do it.
Did Dr. Wiggins counsel you as far as the different types of implants and the different options for size and incision? Did he spend enough time with you going over the procedure?
Absolutely. It was a great education. I came in with one idea. I thought I might want a smaller size, and we discussed it, and in the end I went with Dr. Wiggins' recommendation, and it's perfect.
Did you feel any pressure to sign up for the surgery?
Absolutely not. No.
So neither his staff nor Dr. Wiggins?
No. It was my decision, and after talking to him and knowing the office as I did, I was very comfortable. I still took time to think about it. Nobody ever pressured me, and when I was ready, I signed up.
Now, prior to your surgery, had you had friends that had had the procedure, and if so, what had they told you, and what were your expectations with the procedure?
I do know several people who had it, and so I thought it was for me, but their stories involved a lot of discomfort for a while. They kept warning me it could be a week before I could lift my arms, it would be a couple of weeks before I really felt okay again. So I was prepared for the worst, having had the surgery. It didn't dissuade me from having the surgeries, but it was something I kept in mind that I was going to have to deal with.
And had your friends had any problems with their surgeries, or was it just more pain? Or
some were fine. They all had pain. That was sort of across the board. Afterward, post-surgery, there were a couple of people who had real issues. They had to go back, they had infection, or they had to go back and have some kind of adjustment pain. I'm not sure exactly what it was, but I do remember that I had 2 friends who had difficulties after, and it took several months for them to get it straightened, and I'm not even sure in the end they were really happy with it. But
and they went to surgeons other than Dr. Wiggins, is that correct?
No, right, not Dr. Wiggins.
So when Dr. Wiggins told you that you were not going to have a lot of pain or discomfort after the procedure, did you believe him?
No, not really, although he seemed very confident in that. And he told me some stories, of folks who had been very comfortable, but I still expected to have some discomfort because of the other things I'd heard from friends who had gone through the surgery, so no, I didn't really believe it.
So tell us a little bit about the day of the surgery and how it was, after you woke up and the next day and maybe for the next week. Tell us how you felt.
The morning of the surgery I was nervous. My husband obviously brought me, and I was nervous, but I knew I was in good hands. So when I woke up, there was pressure. There wasn't pain, but there was pressure. And I was wrapped pretty tight, but I went home that night and I felt fine. Dr. Wiggins suggested I take pain medicine that evening as the anesthesia wears off and things like that, which I did. But the next day, I probably shouldn't have, but very gently, I was unloading the dishwasher and going about my morning, making breakfast, and I really had no discomfort. There is a tightness that you have, but it's not painful and it's not uncomfortable to any great degree. And over the next week, it just got better and better. I never took the pain medicine after the first night. I'm not crazy about the way it makes you feel, but I didn't really need it. And I was shocked, absolutely shocked. I couldn't stop telling people how easy it was, how comfortable it was, and it had not at all met the expectation that I would have some pain. So I was very happy, and you know, once the swelling subsides in a couple of weeks or months, I guess, it's great. It's just wonderful. So it was a very easy first week.
How soon after the surgery were you raising your arms up?
The next day. I mean, you know, not over your head. That takes probably a week before you're really moving. But again, I was doing light chores and going about my day. I went back to work and I was perfectly comfortable.
So you were surprised as to how easy the recovery was compared to what you expected?
Yeah.
So you've continued to see Dr. Wiggins since your breast surgery for Botox and things like that. Have you had a chance to talk to any other patients or see any other patients in the waiting room? Or have you ever seen any unhappy patients in his office?
No. Everyone seems perfectly happy to be there, just like me.
If you had a friend that was going to have plastic surgery, and in particular breast implant surgery, what would you advise them?
I have advised them to go to Dr. Wiggins because my experience was so good, and I would continue to do that.
And why did you offer to do this video testimonial?
Because I absolutely believe in this office and the procedure, and especially the doctor. I know it could have come out differently somewhere else because I've heard stories from people, and so it just was a pleasure to do this and let people know and pass on my experience in case anyone else is thinking about doing this.
So you haven't been paid or rewarded in any way?
No.
You volunteered to do this?
Absolutely.
Your video is going to be seen on a website called painlessbreastimplants.com. Do you think that's an accurate name based on your experience?
Absolutely.
Okay, thank you very much.
You're welcome.